If your feet feel completely normal during the day, but the moment you lie down at night, they start tingling, burning, or feeling strangely hot, you're not imagining it. And more importantly, it's probably not happening for the reason you think. Most people assume it's just fatigue, or age, or bad circulation. But in many cases, what's really happening inside your body at night is very different from what you've been told. And once you understand this, everything starts to make a lot more sense. Hi, I'm Dr. Alan Brooks. And over the years, one of the most common questions I hear from adults over 50 is this: Doctor, why do my feet only burn when I go to bed? They tell me their mornings are fine, afternoons are manageable, they can walk, move around, go shopping, and spend time with family. But then nighttime comes, they lie down, the lights go off, and suddenly their feet feel like they're buzzing, tingling, or warming up for no reason. Some people even say it feels like tiny electric sparks under the skin. If that sounds familiar, you're far from alone. This pattern is extremely common, especially in people dealing with diabetes, circulation changes, or sensitive nerves. But here's the surprising part. For many people, the discomfort isn't actually worse at night. It just becomes more noticeable. Let me explain. During the day, your body is constantly active. You're walking, standing, moving your legs. Every step you take acts like a small pump that helps push blood down into your feet and back up again. Your muscles contract, your joints move, your circulation stays stimulated, and at the same time, your brain is busy. You're talking to people, watching television, reading, driving, thinking about errands. Your attention is everywhere. So small sensations coming from your feet barely register. But when nighttime comes, everything changes. You lie down. Your muscles relax, movement stops, the room gets quiet, and suddenly, your brain has nothing competing for attention. That's when it starts noticing every little signal coming from your body. Sensations that were at a level 2 during the day suddenly feel like a level 7, not because they got dramatically worse, but because nothing is masking them anymore. At the same time, circulation naturally slows when you're resting. That's completely normal. But when blood flow slows even a little, nerves may not receive quite the same steady supply of oxygen and nutrients they had while you were moving around. And nerves are extremely sensitive tissue. When they feel even slightly stressed or unsupported, they can become more reactive. And reactive nerves tend to send stronger signals to the brain. Signals that we interpret as burning, tingling, or pins and needles. Now, there are 3 very common reasons this happens more frequently with age. The first is simple circulation support. As we get older, blood vessels may become less flexible, so blood doesn't always move as efficiently into the lower legs and feet. And since nerves depend on that blood flow for nourishment, they can become more sensitive when circulation isn't ideal. That's why even small habits like gently elevating your legs before bed or slowly rotating your ankles for a minute or two can sometimes help your feet feel more relaxed. Those small movements stimulate flow and bring fresh oxygen into the area. The second reason is muscle tension. This one surprises many people. Tight calves and tight arches can place subtle pressure on the small nerves that travel down into your feet. And when those nerves are compressed for hours at a time, discomfort can increase. This is especially common if you spend a lot of time sitting or wearing stiff shoes during the day. A simple stretch before bed can make a difference. Nothing intense. Just leaning against a wall and gently stretching each calf for 30 seconds. Small actions like this help reduce pressure and give the nerves more space. But here's the third reason. And this is the one most people completely overlook. Your nerves aren't just wires. They're living tissue. They constantly repair themselves. They constantly maintain themselves. And just like every other part of your body, they rely on specific nutrients every single day to function properly. Think of it this way. If you tried to build a house without enough materials, progress would slow down. If your body doesn't have the building blocks it needs, maintenance slows down too. And when nerves don't receive the right support consistently, they may simply become more sensitive over time. This is exactly why quick fixes often feel temporary. Ice might feel soothing, massage might feel nice, stretching may relax the muscles. But if the nerve itself isn't being supported from the inside, the same sensations often return the next night. And this is where many of my patients decide to take a slightly different approach. Instead of only working from the outside, they add something simple and consistent internally. Not something complicated, not something messy, just an easy daily capsule with ingredients traditionally used to support healthy circulation and nerve comfort. Something they can take each day without turning it into a big routine, because consistency is what really matters. And when nerves feel properly supported day after day, many people notice they're simply calmer, less reactive, less sensitive at night, which often leads to better sleep and more comfortable evenings. I actually recorded a short presentation explaining exactly how this kind of daily nerve support works and what to look for if you're considering adding something like this to your routine. If you're curious, you can find that presentation in the description and in the pinned comment below this video. It walks you through everything step by step, so you can decide for yourself if it's right for you. Because the truth is, burning or tingling feet at night isn't something you just have to accept. Small daily habits, better circulation, gentle stretching, and proper internal support. These simple steps can add up to a surprisingly big difference over time. Take care of your feet, stay consistent, and I'll see you in the next video.